Welcome to the webinar launch of the Phillips Ives Review. My name is Colette Fretton and I'm the engagement facilitator for this review, and I will be introducing the speakers today. For those that have just joined, we are using Slido to capture all the questions throughout this review. So as and when your questions come up, please put them into Slido. You can see on the screen how to access that. You can either use the QR code or you can log on online and post your questions there. And we will answer as many as possible at the end of the session, but we will take all the questions and put them on the website shortly after this review. You also will see that there's an option to like the questions. So if there are questions on the Slido that you want to ask or really keen to know the answer of, please like that question, and the most liked questions will come to the top of the question list. So at the end of the session, we'll provide an opportunity for questions and answers. We will attempt to answer as many as possible, but as I said before, all of the questions will be answered and posted on our website, which you'll see at the end of this review. I'd now like to introduce you to Dr. Natasha Phillips, the Chief Nursing Information Officer and Director of Digital Clinical Safety for NHS England and Chair of the Phillips Ives Review. Natasha.
Thank you very much, Colette, and that's a very long title, isn't it? So I felt for you there, trying to get through that. So I'm really thrilled that we are here at this point today, and that there's so many and such a diverse group of people who've joined us for the launch of what will be a really interesting year of discovery. It's great to see that we've got not only multiple professions represented here, but I think also I noticed from the list, we have research, practice, education and leaders on the call, and those are obviously the pillars of our practice. So knowing that we've got that breadth is really great, and I'm thrilled that people are coming along to find out more about what exactly this review is. So I guess the thing is, what is it? Well, today is the start of a big conversation. I'm hopeful it's going to be a rich conversation where we bring a wide breadth of expertise to examine the preparation of nurses and midwives for working in the digital age. I guess, who are Phillips and Ives? Well, I'm Phillips, so I'm Natasha Phillips, Chief Nursing Information Officer for England. Probably want to know a bit about why am I doing this. My background is as a nurse, 27 plus years now. I think I stopped counting at 27 years actually. I'm a passionate improver, and I hear that lots when I meet nurses who've taken an interest in the specialism that is nursing informatics or digital change. I've led quite a lot of large-scale change that has a digital flavour, because essentially it's really difficult to do things about improving our NHS without some component part being about digital, when that's the way we all live our lives. And I guess what's important to me and why I'm Chief Nursing Officer for England is my values, really. So I'm a passionate nurse. I think we have a very unique function. I'm very proud of the contribution we make to people's lives every day in terms of helping them live their best lives, regardless of what disease they may or may not have. So a real passionate nurse with a desire to make our nursing practice better all the time, and a desire for all clinicians to advance their practice circled around that patient. And I guess the other core value to me is about investing in staff. We can't do it without our staff. They need to feel valued, they need to feel heard, and importantly, we need our staff to have the right education to enable them to deliver outstanding care to our patients every day. And with things shifting so much with a digital focus, that requires us to look deeply at what should that education look like, which is really why we find ourselves here in this review. And the final important thing to me as a researcher is academic rigour. So that's why we're doing this review. I've been in post now for 2 years. We've done lots of tactical things about this, but we've got a massive change to deliver. And I think the changes we make need to be carefully considered and evidence-based, which is why we're going about this review. So that's why we're having this conversation now. And later you will hear about the focus and approach that we're taking to this. And we've taken quite a lot of time to think about that. So the team will bring that together and present it to you so that we do have that real rigor behind what we do. But before I do that, I guess you want to know who Ives is. So I'm going to introduce you now to Jeanette Ives Erickson. She's Chief Nurse Emeritus at Mass General Hospital in the US, which last time I checked was the #1 hospital in the US. She's the chair of the Commission on Magnet Recognition. And I think in her tenure as a chief nurse, she's had a relentless focus on practice, education, research and leadership, focusing on really good professional practice environments to allow care to flourish. And I think that's some of the expertise that she brings to this review. I had the pleasure of meeting her when I was on my Florence Nightingale Scholarship, and we've maintained a connection, and she's really widely published in this area, and I think she's going to bring real expertise to our work. So I'm really thrilled that she said yes to being my vice chair on this review, and I'm going to hand over to her now to say why she has agreed. So Jeanette, over to you.
Well, thank you, Natasha, for that kind introduction. And colleagues, I am just delighted. In fact, I'm honored to be asked to be the vice chair of this review with my friend and colleague, Natasha. As Natasha said, I was the chief nursing officer at the Massachusetts General Hospital, having served for 21 years. I'm currently the president of a small critical access hospital that happens to be 30 miles off the shores of Massachusetts, called the Nantucket Cottage Hospital. So I've been able to see the broad needs of clinicians and of course the patients that we serve, not only at an academic medical center, but in a rural health center. My passion is pretty similar to Natasha. I care deeply about the work of nurses and really the necessity of maintaining the integrity of the nurse-patient relationship. And I think that is some of what we hope comes out of this. How does this digital age support the work of nurses so that we are more efficient and we can spend more times collaborating with colleagues across all disciplines. I'm also hoping my 6 years now being on the Magnet Commission and the last 3 as the chair of the commission helps to bring some information regarding evidence-based practice and how evidence and nurse-sensitive indicators really help to elevate the quality of nursing practice. So again, I'm delighted to be with you. We have a lot of work to do, and we will be describing how we're going to get that work done in the next few minutes. But now I'm really honored to introduce James Freed. You can see from this slide that he has an impressive title, but he also has had an impressive career. His career has taken him through cancer research, change management, and standards development, as well as being the Chief Information Officer. He is the director of the program responsible for delivering digital readiness to the 3 million staff in the health and care in England. Just one little nice fact about James. In 2017, he was voted by his peers as one of the top 100 influencers globally in health IT as part of the Hit 100 Twitter campaign. So he's a fellow of the British Computer Society, and I think probably the best title he might enjoy is that once he was the governor for his daughter's primary school. So colleagues, James Freed.
Thank you ever so much. God, I'm quite impressed at myself there. Thank you. Well, what I should say first of all is I am absolutely thrilled to be able to support Jeanette and Natasha with this review. It is necessary, it's absolutely needed, and I can't wait to see it get underway and see the sorts of things it starts to uncover. One of the things in that rather long introduction that you might have noticed is I'm not a nurse or a midwife. So it's probably worth me explaining what my interest is in this review. I'm here to support. and make sure that the outcomes of this review are as impactful as they possibly can be. So I'm the senior responsible owner for a programme of work that is looking to support the entirety of the NHS and indeed social care workforce to develop the digital skills required to work, operate and indeed live in a 21st century society. And so this review will, building on the good start of the Topol review, really contextualise the needs for the nursing and midwifery workforce and help me and my team work out how we can support you and your colleagues to be as contributory as you possibly can be, to realise as much value as quickly as we possibly can do for those people we serve, the patients and their families, and the general public. I'm really interested for a number of reasons. So the nursing and midwifery workforce comprises about half of our professionally qualified clinical workforce in this country. So it's a significant step towards understanding our overall needs. But one thing that I should say is that this review is not about a review of technology. So this is not about gadgets or widgets or digital. All the digital toolset is a means to an end. And so that absolute focus that Natasha and Jeanette have both spoken about, that passion for delivering more value to patients, is absolutely what underpins the reason why we need to have these skills and need to make better use of data, information, knowledge and technology in our day-to-day work. And I'm really excited to see what the review will uncover with regards to how we need to plan for the future workforce, how we need to recruit, but also how we need to support the education and training of staff in post. It's a really interesting time. It's really hard to see what's going to happen in the future. And that's why this rigorous academic approach to the predictions that we need to make so that we can make some of those planning decisions now is so important. So thank you very much for inviting me. I'm now going to introduce our next speaker, who's Tracy Eyre. She's the programme lead for nursing in the Digital Readiness Education team. Thank you very much, Tracy.
Thanks, James. Could we go to the next slide, please, Ian? Thank you. So, as James mentioned, I'm Programme Lead for Nursing the Digital Readiness Education team, and I'm also a member of Natasha's team. My background, much like Natasha's, is in ITU, but spent a number of years working as a digital nurse specialist. So everything we're doing here is really close to my heart, and I'm passionate about what it is that we're trying to do. So what I'm going to do is give you a little bit of a background of how we've come to where we have with the themes for the review, and then I'll be handing over to Judith Dando, who's our programme manager. Next slide, please, Ian. So I think it's really important to share Natasha's vision, nurses and midwives being fundamental to the effective digital transformation of health and social care. The whole vision of the programme is about providing tools and capabilities so that our nursing and midwifery staff can lead and deliver patient care in this environment. Next slide, please. So we've already mentioned Topol. I thought it was worth giving you a little bit of background. So in 2019, Eric Topol delivered a report which focused on providing a view of digital healthcare technologies and what their projected impact on the NHS workforce would be over the next 20 years. He identified a need to bridge the skills gap and future workforce pipeline, specifically highlighting the needs for technical staff. There was a limited focus on the specific needs of the nursing workforce, so it's really difficult to apply those findings to the nursing and midwifery profession at scale. And as you can see, this was the comment made by King's Fund after release of the review. But we know that the pandemic's accelerated the use and adoption of digital devices and systems at a scale and pace that we haven't previously seen by frontline health and care staff in all settings, as well as the people using those services. Next slide, please, Ian. So why now? In 2021, the Digital Maturity Assessment highlighted a variability in the makeup of digital health teams, with an emerging population of digital health leaders in both nursing and midwifery. There was very much a feeling that they had been passive recipients of technology and hadn't been part of the decision-making process. It also identified a need to standardise and define clear education standards for the entire workforce, including pre-registration nurses and midwives. So this includes those who are digitally enabled, so using technology to facilitate care, and those who want to specialise in a clinical informatics role, such as a specialist nurse or midwife, through to a CNIO. Now, the What Good Looks Like for Nursing was launched at the Nursing Summit at Rewired in March this year. Now, that's an operational guidance for chief nurses and directors of nurses to enable them to lead digital transformation in their organisations. So the Phillips Ives review will build upon these along with the findings and recommendations of Topol, and importantly evidence from the pandemic, so that we can determine the needs of the nursing and midwifery workforce with the approach that a nursing voice is needed in all places. It's vital that we have that understanding of what our current state is and focus on that future digital practice and needs of our workforce to provide clarity on the long-term view. This will lead to an education plan for those things that we need to do at a national and systemic level, so we have the workforce we need for this transformation. Next slide, please, Ian. So the review is going to address these 4 key questions to examine the impact of technological advances, both in the here and now and over the next 5, 10 and 20 years. Now, we thought really long and hard about how to address inclusion, equality and diversity, and we made the decision to include it within each expert advisory panel rather than as a separate panel. By doing this, we can ensure that it's embedded and threaded throughout the discussions and then contributing to the focus of future recommendations. We'll also ensure that people and practice are at the heart of the review and those resulting recommendations. We're bringing together national and international experts with expertise beyond nursing and midwifery to investigate, critically appraise and make recommendations to ensure that the breadth of ambition and scope of future practice of that pre and post registration nursing and midwifery workforce is captured. Next slide, please, Ian. So you can see here we have 7 key themes. It may be that the graphic is a little small on your screen. Don't worry, because I'll go through this in the next slides. So again, as I've said, it's informed by Topol, the digital maturity assessment, and what good looks like for nursing, and the challenges and rapid progress in the use of digital technology during the pandemic. So to ensure that we've got a robust joined up review, we've amalgamated these themes into 3 panels. Next slide, please, Ian. So panel 1 visits the Topol themes. We've already recognised that the pandemic's moved digital technology at pace. For instance, Topol suggested that 50% of the workforce would be using remote monitoring by 2028. We believe that this has already been exceeded, so we need to understand where we are to project what that future adoption and progression will be. Now, the chairs for panel 1, we've got Professor Ruth Endicott. She's the Director of Nursing and Midwifery at the National Institute for Health Research, and she's also an Honorary Professor at the School of Nursing and Midwifery, the University of Plymouth, and again a Professor of Clinical Nursing at Monash University in Melbourne, Australia. Cynthia Bargener is the Chief Operating Officer in the American Institute for Healthcare Improvement. She's accountable for a broad set of responsibilities across that organisation, and she's been a Chief Operating Officer and a Chief Nursing Officer at a number of hospitals in the last 18 years. So they're going to bring a wealth of experience to their panel. Next panel, please. Sorry, next slide, please. So panel 2, this is about delivering care to people wherever they are, whether they're at home, a care home, a prison, in the community, in social care or in a hospital. And we've joined it with emerging technologies so that we can use it to support and progress that people-led care. Our chairs for this panel, Molly McCarthy is the Chief Nursing Officer Strategist in the US Health and Life Science sector for Microsoft. Her primary focus is business development and strategy for virtual health at Microsoft, and she brings over 20 years experience in the healthcare industry. Our second co-chair, Dr. Gemma Stacey, is the Director of Academy and Deputy Chief Executive Officer at the Florence Nightingale Foundation. Gemma has more than 20 years experience as a mental health nurse and academic, and she's a principal fellow of the Higher Education Academy and a visiting professor at the University of Derby. Next slide, please. So our final panel 3, this is all about our workforce. It's about the professionalisation of the digital nurse midwife specialist and what does our future workforce look like. Again, following on from Topol, it's been suggested that the NHS digital workforce requires an additional 32,000 technology and data staff by 2030. Now, as nurses and midwives, we know that new technology and electronic patient records need our input, as well as other clinical staff, to ensure that the system meets the need of the workforce and the people we serve. So, for instance, how many nurses and midwives do we need to meet these additional IT staff numbers? Now, preparation for practice includes nurses and midwives at all levels of education, so from undergraduate through to postgraduate, as I've mentioned, including advanced clinical practice. Again, we need to understand what this means for the needs of our workforce, but also for the higher education institutes and education providers. Now, our chairs for this panel, we have Dr. Jen Bichelle-Findlay, who is from Australia, and I believe she's on this call, and it's probably some awful hour in the middle of night in Australia, so thanks for joining us. Jen is a fellow of the Australian College of Nursing and the Australasian Collective Health Informatics. She's an associate fellow of the Australasian College of Health Service Management and a board member of the Health Informatics Society of Australia. She's currently the chair of the New South Wales branch of the Health Informatics Society of Australia and was fundamental in driving the development of competencies and capabilities in that area. Professor Laura Sarant is the Regional Head of Nursing at Health Education England for the North East Yorkshire and Humber area. And she's also Professor of Nursing in the Faculty of Health and Wellbeing at Sheffield Hallam University. I can't impress on you how much we appreciate the co-chairs that we have and the experience that they're going to bring to their panels. What I'm going to do now is hand you over to Judith, and she'll be able to tell you a little bit more about what we're doing and how you can get involved. Judith.
Thanks, Tracy. So Tracy's explained what we're going to do, and now I'm going to tell you a little bit about how we're going to do it. So each panel is going to be made up of the two co-chairs who Tracy has just explained to you. There'll be a sort of prime subject matter expert. There'll be an educationalist, and there will be nursing and midwifery fellows on each panel. There'll also be a range of additional SMEs depending on what the themes of the panel are. And we will also have patient representatives in each panel. Across the three panels, they will be supported by an ethicist, a health economist, and our supporting review team. Next slide, please, Ian. So why is this review important? Well, it's important because it's going to help us meet the aims of Natasha as the CNIO for NHS England, to ensure that nurses and midwives are empowered to practice and lead in a digitally enabled health and social care system now and in the future. And we need to ensure that nursing and midwifery practice is fully supported by the use of digital technology and data science. Next slide, please. So this is the review timeline. So we've pretty much hit the ground running on this. We want to complete this by the end of March next year. And so we are pushing our review panels pretty hard. We are aiming for the first panel to be up and running in the next couple of weeks, and then you'll see that there will be 5 formal panels up until the interim report is published. And we're aiming to publish the interim report at the delayed CNO for England Summit, which is currently due to be on the 28th and 29th of September. So you can see we've got a lot of work to do in the next 4 months. So after the first panel session, then there will be evidence gathering. We have already provided our panels with some baseline evidence gathering. We've given them literature reviews, which are dated from the end of the Topol review. So they will look at the evidence that we've already gathered, but there's a lot more evidence out there, and that's where all of you come in, please. So this is where we need to collect everything that's out there and triangulate it. And to do this, we'll be setting up roundtables, we'll be setting up one-to-one interviews, and we're intending to go along to the Digital Health Summer School. So there will be all sorts of things that we'll be doing in between the panel sessions where we come out to you and talk to you about what you're doing, and we gather the evidence. And I'm going to ask you later, if you do have evidence that you'd like to contribute, then we would really welcome that. So the evidence gathering will go on in June and July. Then the interim report writing will be done by the panels with a view to that publication date, as I mentioned, at the end of September. Then the interim report is coming out to consultation. And this again is where all of you come in, please. There will be a 2-month consultation period. We will ensure that we send this out and we communicate with you widely. There will be a platform which will allow you to contribute, to look at what we've produced and to feedback. And at that stage, we will also have more conversations with all of you. So you are vital to this. It is only an interim report and we need your feedback, please, and we need to to pick your brains and your experience, please, to feed into what will be the final report. So after that consultation period, we will write the final report in December, January and February, with a view to having it produced in March, and it will then start to be circulated system-wide. We will formally publish a report at the CNO Summit at the end of May, and at the same time we will be endeavouring to produce a timeline for delivery of what the report recommends. So there will be a roadmap, a 5-year roadmap for what we intend to deliver. So I've already mentioned a little bit how you can contribute, but you are all absolutely fundamental to this. And when I say all of you, I mean those who work within the NHS and those who work outside the NHS, those who are midwives and those who are nurses, and also those of you who are neither or none of those, but work within the wider health and care sector in different professions. All of you can help contribute to this. So please, after this, all of those who tick the box to say that you are happy to be kept informed, we will be sending you a form after the event to allow you to volunteer your help. This will allow you to provide details of your subject matter expertise or your specific area of interest, and whether or not you are willing to attend roundtable events, for instance. We will also ask you that if you have additional evidence that you would like to contribute, such as details of reports, research and work that's going on in your organisation, you can contribute that to us, and we would really welcome that. You can volunteer to join roundtable events or knowledge cafes. And as I mentioned, we want you to participate in the interim reports consultation period in October and November, and we will ensure that you know that is happening and how you can do that. We have a website, the link is here, the link is also in the chat, and we will keep that up to date with everything that's happening with the review. Finally, we have a website address, so please contact us directly and we will make sure that the right person or the right panel gets the information that you're providing us with. Next slide, please, Ian. So now we're going to go on to question time. I think you're probably all on Slido now. So I'm now going to pass back over to Colette. Thank you very much.
Thank you, Judith, and thank you to all the speakers. So right at the beginning, I think some of you may have missed it as you joined slightly after the beginning, we offered you the opportunity to ask questions on Slido. So for those who haven't seen this, you can either use your phone to access Slido via the QR code, or you can log on to Slido online via slido.com and use the hash Phillips Ives review. Oh, someone said they've lost sound. Can everyone else hear me?
Yes.
Yes, great. Okay. Thank you, everyone. That's getting lots of hands up. That's a lot of responses. So there's an opportunity there to ask questions. You'll see when you log in that there's already been quite a number of questions already. If you see a question there that you're really keen to know the answer on, please hit like and it will move the question up in terms of the priorities. So what I'll do now, what I should say from the start is we will provide answers to all the questions that have been given, either during registration, where you were offered the opportunity to ask questions, and the questions that have been posted on Slido now. These will all be posted on the website shortly, along with the slides from this presentation and the recording. Okay, so I'm now going to just take the questions from the top and we'll open it up to the speakers to answer these questions, and we'll try and get through as many as possible. So the most voted question at the moment is, how do we ensure that digital skills training is embedded and available right from the beginning of careers, e.g. for student nurses and midwives?
Colette, who would you like to pick that question up?
Would Jeanette like to pick that up?
I'm happy to. One of the things, the beauty of the way in which these panels are set up is that these are the types of questions that we want the panels and the participants to engage in. The conversation regarding digital skills training for students throughout their curriculum will become very important, not only for current students, but for our future. So we do hope that the panel does pick that up, and I believe it's panel 3 that we will be sending that information to. And James, I know you have thought a lot about this, so could you add to that?
Yeah, I'd be happy to, Jeanette. Thank you very much. So just to say, I mean, one of the things that we were talking about before this session was that we don't want to second guess what the output of the review will be. And obviously there'll be a huge amount of information and perspective that be synthesized. I think it's unlikely that we're not going to see something, however, that is going to require digital skills training early on in formal career pathways. So one of the reasons why Health Education England is involved in this whole process is because we've got already strong links with the higher education institution sector, not just those universities, but other education providers as well. So the governance bodies that influence those institutions as well. So people like the Council of Deans, for instance. So we do have ways in which we can influence or indeed commission training into formal and informal routes for learning. But we want to be led by the evidence. We want to make the investments that are going to have the biggest bang for our buck effectively.
Thank you, James. Perhaps you could help us with the next question as well. This is the other side of the discussion, is how do we ensure patients who do not have digital resources or skills have equal access to services, as I see a digital health gap emerging?
Yeah, this is true. So one of the issues that we have, actually not just in the health service but anywhere in government, is that we can't pick and choose our audience. For the ones that are easy to serve, we're there to serve the whole population, of course, and that includes people who have difficulties or otherwise have fewer chances. So that includes digital literacy, includes health literacy issues, and we're there to serve everyone. One of the reasons why the Digital Readiness Education Programme exists, and this is not just limited to the support provided for nurses and midwives, but for the whole workforce, is to support those of you designing services to recognise that even when we're looking at digital tools, a service needs to provide support for people who are less digitally literate. And that means multiple channels in multiple ways, so we can support everyone in the way that they are best able to be supported. So again, don't want to second guess what's going to come out of the review, but I have no doubt that it will address this issue.
Natasha, you had something to add?
I did, thank you, Colette, and James has answered beautifully, but I would like to add one other thing, which is firstly to reiterate the review has been structured so that we can answer exactly those types of questions, because the review starts with our practice. And so to add to it, what I'd like to say is the nurse and midwife are uniquely placed in terms of our advocacy roles. So I would be very surprised if this does not come out as part of the review, that we should be coming away with some recommendations that say, what do nurses and midwives need to pay attention to in this space, and therefore how do they need to be prepared through education to be able to pay attention to those things, whether they be a point of care nurse or midwife, or a nurse or midwife who is leading whole systems, or a nurse or midwife who is leading digital change.
Thank you. And Jeanette, did you have something you'd like
Yes,
to add?
I would add that one of the beauties of the way in which these panels are structured is that the voice of the patient will be present in each panel. And so I think understanding from our patients some of the limitations, the fears, the expectations that they have, we should encourage not only answering this question, but in all of the panels and all of the questions that come up. And hopefully the economists that are also joining these panels will help us to understand the impact of not having equal access to care. So I think our panels are structured to answer these questions beautifully.
There's a comment there from, sorry, I didn't see it, jumped off my screen too quickly. Midwifery have the maternity voice partnership, can also support co-production. Thank you, Terry.
We will make sure We work really closely with Jules Gudgeon, who's our national lead digital midwife. She's working closely with us on that. And our Chief Midwifery Officer, Jackie Dunkley-Bent, has given us a core list of key midwives that will contribute to this. So they will bring exactly those sorts of things to the fore. But as we've said here, we're calling out for everyone to contribute. So if you have a thought or an idea, please use the channels we've created to make sure that it comes through, so we do have that breadth of voice and really consider both nursing and midwifery practice equally and carefully.
Thank you. So the next question put to Natasha is, can this be the review where we define and produce best practice guidelines for the term clinically led and embed this is not limited to medics?
Well, Claire, good to see you on the call. I recognise that question and have felt it. To be honest, I'm not sure entirely it will, but I'll tell you what it will do, is it will bring a breadth of clinicians, not just nurses and midwives, to a deeper understanding of how we prepare nurses and midwives, and probably form a template for maybe how others start to look at some of these questions. I like to think that we can we put, and certainly the way we've constructed the review is to put the patient at the centre. So I'm not so sure that getting involved in a debate about who's a clinician is always so helpful, and I think it's bigger than digital, but perhaps it will end up with a statement that is how we define clinically led. So I wouldn't rule it out, but I don't think this is the only place where that conversation happens. And what the most important outcome that we come away with is, what do nurses and midwives need to practice safely and effectively in digitally enabled healthcare? And that will require the panels to think about, and who do they need to work with? So where do they draw on other skills in order to do this work, and who depends on us? So some real rich debate. And Claire, do register your interest if you're interested in any of the roundtables or submitting further thoughts.
Thank you, Natasha. So the next most voted question is there any plans to incorporate digital clinical safety into statutory and mandatory training to help establish a safety culture within trusts?
I guess as the National Digital Clinical Safety Lead, this one falls to me. So within the bounds of this, I'm sure digital clinical safety will come up as, you know, a core competency for nurses who are leading digital change and having an awareness for all other nurses. So I think what I would steer the person who's asked the question to is to look at our National Digital Clinical Safety Strategy, because that really clearly talks about how we move to a culture where digital clinical safety is a core part of how we address quality and safety in care delivery. And that means shifting from a place where we just have clinical safety officers who look at 2 digital clinical safety standards and approve cases for digital systems. It looks to build on that, strengthen that, and think about how do we look at safety in its widest sense to make sure that the workforce is prepared. So we have as one of the 5 core strategic aims within that, and 4 commitments that we've made nationally, a plan to scale up training significantly, moving from a sort of foundation level training and awareness level training all the way through to that expert training, much like we do for things like safeguarding. And I guess the question about whether that's mandated will emerge as we do that work in the coming year. But the most important thing is that we liberate knowledge and therefore scale up our training significantly.
Thank you, Natasha. The next most voted question is there any plan to incorporate digital literacy into student nursing and midwives curriculum?
So I suppose the caveat for a lot of these things about what's going to come out of the review will be, let's wait until we see what comes out of the review. But also, it's probably worth saying we are where we are, and that means that we've started in some areas. So Health Education England has been commissioning over the last couple of years some blended learning degrees, undergraduate degrees for nursing, a relatively small number, to explore what that looks like. Now, and I believe that in some of those cases, the universities have incorporated a tool called the Digital Skills Assessment Toolkit into the delivery of that curriculum. What I'll do is I'll pop a little link into a video about what the Digital Skills Assessment Toolkit is. It's a bit rough around the edges, so you have to bear with us on that one, but it will give you an idea about what it's trying to do. In short, it's a way for individuals to assess against a common and broad digital literacy framework, which is published on the HE website. 32 questions, where they think their role requires them to be and where they think they are themselves. And then there's an algorithm in the back end that will point users of the Digital Skills Assessment Toolkit to some bite-sized learning to help address the biggest gaps. So I suppose that's a long answer to say, yes, there is already. It is not nursing and midwifery specific. So that digital literacy tool at the moment is aimed at the whole workforce. It'd be lovely to see what the review says in terms of how we make that more specific and more nursing and midwifery focused.
I would only add that if we go back to the vision statement where we began, and we think about the care that we want to deliver in the future, being safer and more efficient, we really have to build this work into the curriculums. Like James, I don't want to decide what the panels are going to come out with for recommendations, but for me, this question aligns beautifully with the vision statement.
Thank you, Jeanette. The next question I have is, will we be looking at a minimum standard of education for a nurse informaticist, CNIO, and will we be working with the NMC on this for appropriate accreditation?
Do you want me to take that one to start with?
Yes, please.
Again, you know the drill. We're not second guessing. We've deliberately gone back to do, to commission a group of people and a big, robust piece of work to look at these questions in depth rather than jump to answers. But I think it's probably reasonable to assume that we will come up with something that says this is the knowledge and skills our specialist workforce needs. And of course, if we do that, we need to commission programs of education that deliver those minimum skills. So I suspect, yes. What it looks like, I don't know. We have existing international models. I saw a question before about why international, so I'm going to weave the answer to that in here. We have examples of international models from colleagues in Australia, in the US, who have very defined roles for what a nurse informatician is and defined programs of education. Whether we go down that route, whether we take a more blended collective clinical view on what the education looks like, where we start in terms of that education from a bite size to masters to whatever it looks like. We already have a model for specialist practice in this country, which is about starting as a clinical nurse specialist trainee through clinical nurse specialist and nurse consultant. Perhaps we'll end up in that realm, but I think we need to let the panel do their work to determine that. And then in answer to the NMC, well, they do set the pre and postgrad education standards, but not specialist practice per se. So we will engage with the NMC. They will be a core part of this work. And of course, when it's delivered, I have an oversight board that has the chief nurse from the NMC, that has the the president of the RCN and all the key people that we need to have to oversee delivery of it. So they will be very tightly wound into what we do. So they certainly have a contribution to make, but it's a bigger piece, which is why we take the collective leadership approach that we do.
Thank you. Okay, we've got time for a couple more questions. Will this review include recommendations of digital roles within trusts for consistency, please?
It's a perennial issue, isn't it? The consistency of roles, and I noticed the question about the consistency of banding. Let's start at the beginning. Who do we need? What do we need them to know? And let's define this through this review. The review is focused on giving us a roadmap for education of the workforce. The what good looks like guidance alongside it is an operational plan for chief nurses to take up, and that already gives them some indication of the roles they need. It doesn't go so far as to say, here's a standardized set of roles and responsibilities. I think in this review, we are likely to come to a conclusion about what those are. it is likely that in our further iterations of what good looks like guidance, we might pick that up so that chief nurses have the ingredients they need to build their team. So more of an idea about roles and responsibilities. I'm really mindful to just set expectation that this is a great opportunity to understand the work that we do, the knowledge and skills that we need, the shape of the workforce we need, and therefore how we educate them. But there are other component moving parts that also will need to take that work forward in terms of operationalising it in practice. And conversations will no doubt continue once we have these findings, which may take us to a point where we set some standards for organisations in terms of what teams they have. But the first bit is this part. So let's do part one and see where we go with that. I know that many digital nurses are crying out for this because we know we have variety from band 7s all the way through to band 9s. I think this is a big part of answering that and getting you to where you want to be. So the important part is to contribute, but importantly, I would always urge everyone as well to stay curious about where this investigation takes us.
Thank you, Natasha. James, I think you've already answered this question, but let me ask it to you. Will there be a national digital literary assessment tool or survey?
Yes. Yeah, there is. So we're in a stage that's called private beta at the moment, which just means we're trying to test it with a few select groups to make sure we're doing the right things and it's having impact. But I think we're on the cusp of making that a bit more public. I've put a link in the chat so if your organisation doesn't have access now but you're interested in having a little look and trialing it, there's a link to request more information and maybe request access. There's also the link to our website there, which may not have answers to all of your questions, but it's a good first place to have a look.
Probably another question for James. Will we ever be in a position for standardised digital systems to be used across the whole of NHS? Issues re procurement, security, quality, but can we overcome?
Holy moly. So that's out of the scope of this review, I think, and out of the scope of responsibility, but I will give you a personal response then, if that's okay. So that implies that standardization across the country is a good thing. And sometimes that's true and sometimes that isn't. So what we learned from the National Programme for IT is that ruthless standardisation does not equate to the best answer at all times. I worked for them between 2003 to 2006, and about 2008 the programme was referred to as the £12 billion failed NHS supercomputer. We don't want to go back there. But at the same time, we know that there are problems that can be solved once for all, and should be solved once for all. What I see from working with colleagues in NHS England, what was NHSX and NHS Digital, is a real desire to get that balance right between what decisions need to be made locally, what decisions need to be pushed as far to the local as possible, even to the bedside or to the patient. I mean, we've got consumer technologies nowadays, so not everything needs to be answered once for everyone, and that's a really difficult question to answer. Yeah,
thank you. So we'll keep that out of this review. 2 further questions and then I think we'll need to close. Will slides be sent out? We said earlier in the presentation, the slides, the recording and all the questions that you've given to us will be posted on our website after this review. You'll need to give us some time to just pull it all together. So I would say within the next 2 weeks, you'll have access to all of the materials. Hopefully that answers that question. Then the last question is, will there be a national framework for competency assessment across the workforce for consistency?
I think, again, we need to wait and see what the outcome of this review is as to whether there are already many existing competency frameworks, many existing national competency frameworks. Our colleagues in Northern Ireland and the Irish Republic published one last week, so they will no doubt be given consideration. But what we need to think about is how are those frameworks taken up and where's the education that supports the acquisition of those competencies. And the purpose of this review is to give us a roadmap for the education of nurses and midwives. It's not the only thing we're doing. So many of the questions that were being asked are being dealt with, but they're outside of the scope of this review. But this review starts with the premise that if we invest in and prepare nurses and midwives for the work that we want them to do, then patients will have better outcomes. And we need to relentlessly stay focused on that as panels. And I think that's the job of Jeanette, I and James as chairs and SRO, to make sure that we relentlessly stay focused on the outcome that we want to achieve, to make sure that we deliver something that we can take forward as a roadmap in the next 5 years.
Thank you. And I think that draws us to the end of the presentation and questions and answers. Ian, do you have one last slide? So I'd like to thank everyone for attending, and particularly the speakers for joining us. I think Jeanette had to get up very early to be here today, so thank you so much. And to those international participants that woke up early or stayed up late, thank you so much. It's been great to have you here. We've given you the contact details, and we'll send you an email afterwards with how to get in touch and how to express an interest in either attending or sending in information. And it's really important that you're all part of this. So if you'd like to contribute, please fill out the expressions of interest form that we'll send to you, and then we can get in touch and ask for more information. As we've also said, we've got an email address that you're welcome to email us with anything you need. Okay. Thank you very much. Does anyone else want to say anything before I stop recording?
Thank you, everyone. Great questions and a wonderful beginning for this work.
Thank you so much. Thank you, everyone, for your time.